Morning, everyone, and thank you for taking time to be here, and thank you, Dr. Li and Dr. Kwan for the introduction. And yeah, a lot of my research related to AI stuff. So if you're interested in that, and I have another presentation in the afternoon, so I just want to make a attachment, join us, and for the AI stuff. Now, we're back to more basic, or really basic stuff using animal models to understand how the therapeutic potentials of psilocybin and how it's used and what's the mechanism. I wonder how many of you actually heard about psilocybin or kind of like worked on it? Wonderful, great. Yeah, wonderful, thanks. Yeah, it's been a very hot topic for the last 10 years. And if you search journal publications, it's on Nature and Science, almost everywhere, and sounds like the next revolution about psychiatry treatment. So, yeah, but before we dive in, I just want to really reiterate like how important and why psychiatry and mental health matters, particularly depression, which relate to my topic here is. You know, it's probably one of the most socially impact conditions in the world, and have 3 million people globally affected and at this moment. And there's 6 million new cases in Canada. Canada is a small country, and every year, oh, sorry, I don't think it's, yeah, 3 million cases, yes, about right, yeah. So it causes such a big disability because it starts very early. People won't, recover for years, even several decades. And more than 50% of them have a cognitive impairment. And 1/3 of the population are not responding to the treatment. So that's why we're so desperate for new treatment to improve this condition. I think all the people who are sitting here as a psychiatrist, as a psychopharmacologist, as any person worked in the mental health would agree with me that we're not doing a good job. So now, for the last 10 years, psilocybin has been, or psychedelics in general has been brought up, resurfaced, or rejuvenized from the old idea that this kind of substances or medication give us a new hope to say it might be a solution for mental health, particularly for psychiatry. So one of the interesting angle is psilocybin is coming from mushroom, and it recently in 2018 being listed as a breaking through therapy by FDA, and it's called psilocybin-assisted psychotherapy, and for major depressive disorder and also treatment-resistant dissonance. Different from our traditional medication that patients need to take them on a daily basis. And all the psychedelic-assisted psychotherapy only delivered a few sessions. And after a few sessions, we will expect patients have a significant and long-lasting benefit from it. So that changed the whole concept and also the mechanism behind the treatment that we always believe, and through serotonin receptors, through the continually modulating the neurotransmitters. So, yeah, but we did not know much about psilocybin and its treatment, particularly that it's further complicated by the by psilocybin-assisted psychotherapy. That means that one medication combined with a psychotherapy together made a difference. But whether the medication itself actually will be beneficial. So before we dive in, I just want to give a quick introduction about psychedelic-assisted therapy, which we can use a different type of drugs like LSD, psilocybin, and MDMA, and to facilitate the psychotherapy process. Patients will be under the influence of the substances, And during that period, the patient under the influence, and we altered their cognitive and the cognitions and the cognitive capacity, and reduce the defense, give the opportunity to revisit their memories, to give a different meaning of their life. So that makes it quite different from our traditional psychotherapy. Traditional psychotherapy patients will be very guarded and very well intent defense system, and so we try to reduce that system and to make us to reach to the deeper memory. So a typical thing will be 3 sessions and interviewed by a few weeks or weeks, and then so after that we would assume that the patient does not need the ongoing treatment after that. Also, that's in the real world, it can change. It varies differently in terms of patient to patient and also the condition to condition. So, yeah, so psilocybin actually is a natural product coming from a certain type of mushroom. And this mushroom actually has been used for years, for thousands of years by indigenous populations for religious rituals, for connecting them to the superpower and to use them to really link to the nature. Particularly that's when we use in North America, and a lot of our indigenous populations and First Nations use them and to really make sure that they're part of the nature, they respect the nature and understand the nature. So psilocybin itself, when it's consumed, and will go through the liver and then being converted into called psilocin. Psilocin is a pharmacologically active product of psilocybin. It can penetrate the brain barrier and brain-blood barrier, and then to work on the serotonin 2A receptor. So a bunch of different receptors will be involved, but serotonin 2A receptor is considered one of the most prominent and at least leading to the hallucinations that psilocybin causes. So, yeah, psilocybin, when it affects the serotonin 2A receptor, it causing this kind of delusion-like feelings. They have vivid colors and they have a different narrative of the not regular things we see, and they get into outer conscious state. So it's pretty much like people in the dream, or they have a completely different view of the world, and after they take this medication. So it has been long associated with therapeutic effects. That means that patient need to have this hallucinations and to become effective for the treatment. But whether it is true or is it something that's we don't know yet. And so that's why my research using animal model is trying to look at these differences here. Is what the effectiveness of psilocybin itself as a mono treatment without psychotherapy. Why it's important is because psychotherapy costs thousands of dollars. And if we can reduce that, we can eliminate that from this treatment, we will give a phenomenal access to the patient. Almost everybody can afford psilocybin, but very few people can afford psilocybin-assisted psychotherapy. And second one is this hallucination essential for the treatment? So that really involves the mechanism behind. Ideally, we do hope that the patient does not need to have those hallucinations, bad trips, to get benefit. And if that's the case, it can also help us to make a legal case easier in many countries. Currently, in Canada, this one is still under a special license for the treatment. And in majority of the countries in the world, it's still illegal substances because of the hallucinogenic natures. If this one can be eliminated or does not really associate with the treatment, then it will really help us to promote the medication and without causing a significant harm. Anyhow, so using animal become very essential component because first, we cannot do psychotherapy on animal. So all the benefits must come from the drug. And second, we can do a lot of biological studies, so we cannot use human being. So that gave us a perfect way to do. So in this one, what we had is we designed a different model of depression. Because traditionally, depression model would be we force animal into a very hard conditions and animal cannot escape. Then they become despaired. But those animals are very likely get into a stage in psychiatry we always called adjustment disorder, which means that all of us gonna be depressed if we lose our job, if we get into a very hard condition, we cannot control it. But when the situation is removed, we'll get better. Majority of people get better. That is not depression. That is adjustment issue. So how can we make this different and more close to the real world? Which is we use one of the animal called Wistacuto. This animal have some genetic predisposition to make them vulnerable for depression. So when they get into adolescent, and the animal even can spontaneously get into a depression stage. So we try to use this to mimic the real world depression that's with a genetic and family predisposition and long lasting and persistent depressive like episode rather than just episodic related to the external pressure. So using this animal, what we did is we provide them 2 times and exposed to the predator's odor. So we have some synthetic substances, smells like fox urine, and we expose that to the animal twice in 40 days, and to mimic the conditions that they're under of significant stress. After that, we just keep changing their roommate or the cage mate of the rat to make them very lack of social support, very stressed to get into social situations for the rest of the time. And meanwhile, right after the exposure to the predator's odor, and we will provide a small dose of psilocybin. And so you can see, different from most substance or drug treatment, we only treat the animal twice, use a very small dose in a duration of 30 days. So, yeah, and after that, we had a few different tests, like open field tests to look at what's the animal's anxiety level, what's their motivation, what their motor functions, whether they have any issues with moving around. And then sugars preference test to look at if animal have actonia that's not enjoying the sugars that they used to be, which is one of the more reliable indicator for depression in animals. Of course, we have another very classic one called forced swim test, which animal will stop struggling and trying to escape if they are more depressed than the animal not. So overall, and also elevated plus MACE, which is one to measure the anxiety. So. Okay. All right, so look at the data. That's after 2 brief treatment, and then we leave the animal for almost 20 days and continually experiencing social instability. And by the date of 30, and we test the animal using the forced swim test and the sucrose preference test for depression-like behaviors. And you can see, and the animal who's under the social instability stress, and but treatment with psilocybin, even like 2 simple dose, and have a significant improvement, and the animal will swim longer, will have less immobility, and will consume and like the sugars and more than the animal in the depressive mode, but without the treatment. And the animal's cognitive functions also has significantly improved with the psilocybin treatment. If you see this novel objective recognition study, showing that even with a very small dose, very brief treatment without any psychotherapy, psilocybin can really change the outcome of the animal, particularly particularly that's with some cognitive improvement. So then we did some brains, like homogeneous brains, and then did some Western blot and to look at the BDNF. And the presenters that before me already showed that how the BDNF is important. It's kind of like the common pathway for all the treatment for depression. And you can see, first of all, the animal under chronic stress presented a significant cortisol level elevation, which we all know is not surprising because it definitely messed up the HPA axis and lead to a chronic stress. And psilocybin can actually decrease it significantly. So it's very interesting to see how psilocybin is may not only going through serotonin receptors, but also provide a very different angle with rapid and powerful benefit. So the BDNF part, we can see the distribution or the change of BDNF are brain region specific. In the hippocampus part, we did not see any significance, but in hypothalamus and in amygdala and also prefrontal cortex, they both have increased BDNF expressions after the treatment of psilocybin. So, and also mTOR, and if you see the right on very right side of this, do I have a? Okay, later. Okay. Yeah. So if you see that, and you can see, particularly in a PFC area, and the mTOR expression increased significantly after psilocybin treatment. But remember, the last dose of psilocybin treatment was 20 days ago. In animals, it's probably months or several months if we convert into a human life. That means it's a very long-lasting and powerful effect of psilocybin, and to affect not only the serotonin receptor itself, but also affect the downstream and common pathway that matters to treatment. mTOR is one of the major mechanism pathway for ketamine treatment. So we can think that this probably linked or converted different treatment into more common and universal approach. So the next, we actually want to look at a different part. These two parameters actually mirror the cannabinoid receptors. The cannabinoid that's linked a lot with the cannabis use. And the cannabis use has been legalized in Canada for recreation. But it's been long used for medical purpose since 2008. So, but we still have a very controversial opinions about whether cannabis has benefits or causing harm and in the society. But from here, we can see psilocybin itself, even that it does not directly interfere or directly interact with cannabis receptors, it actually can change the cannabis cannabis in endocannabinoid, because the 2-AG is the equivalent of cannabis inside of the brain. It can actually significantly decrease the expression of the in the endocannabinoid, but increase the serotonin CB1 receptor, the cannabinoid receptor 1. Cannabinoid receptor 1 has been linked to depression, anxiety, PTSD, and also cognitive impairment in many, many research. So by doing this, we actually linked something seems far and irrelevant into under same framework or into categories. So that's really interesting to look at how things are different. So we look at the similar treatment. All the data I showed is in the regular animals without a genetic predisposition, but the rest of the data are quite similar to the data in the Vista rat, but using called Vista Q2 rat. It's a spontaneous treatment-resistant depression animal model. And we find that even in this challenging model, psilocybin treatment can provide significant benefit. Similar data also showed here, but a very interesting part is in this kind of like a treatment-resistant depression, and psilocybin does not affect us like a cortisol or HPA axis, but actually affect the thyroid, the TSH, the thyroid stimulating hormones. So we know that in patients with treatment-resistant depression, a lot of time we use psilocin or use thyroid hormone as add-on treatment, even that patient does not have a hypothyroidism. And I wonder, was this one actually linked to our clinical judgment and also clinical treatment in a very different angle, particularly in the patient with treatment resistant. So here, similar for mTOR and BDNF, and psilocybin can also change their expressions, and it's just the level of the change varies that's compared to the animals without treatment-resistant depression. So yeah, similar like that, and the endocannabinoid system also being affected by psilocybin, indicating that it is a common pathway and behind the psilocybin's biological mechanism. So yeah, I'll just skip this one. Same thing, that's when we go further downstream, and we can see the TRKB expression and also ERK pathway also being affected. And before we have this paper published, and there's another paper published in another group showing that psilocybin actually can directly connect it to TRKB without going through any serotonin receptors. So that's showing there's an alternative mechanism that's beyond the serotonin receptor itself. So why it's important here is if we can modify the treatment psilocybin drug to make it more powerful over TRKB than serotonin receptor, we can very much eliminate the side effects from the treatment, but enhance the benefit of the treatment. So by doing this, we could create a detour or a round way, and to not touching the medical legal or the legal part of the substances in the most of the world, but still provide a good treatment option for the patient. So if here any pharmacologist or companies sitting here, we can probably work together on it to look at how we can modify the drug and become a new channel for the treatment here. So yeah, I will skip that and I will just come direct to the summary part. So psilocybin actually demonstrated very big potential in alleviating emotional and cognitive impairment in both animal models, even under persistent stress with very brief treatment. And the animal's benefits are long-lasting, even when the medication were no more there. And this really helped us to understand one of the psilocybin's benefit and how this one linked to some existing knowledge we have, all the existing and also important areas, for example, like endocannabinoid and the substance, as well as the mTORC, which is linked to ketamine treatment, some existing one that we can think of, we can rationalize our work. So, all right, so I won't leave here, and to ask any person we have a discussion or any questions, I will be happy to answer. Thank you.